we hear lots of mixed messages about caffeine and about coffee. And I'm afraid this study isn't going to clarify those mixed messages, because I think there are a couple of things in here that one needs to take note of. This was a study of blood vessel function in young people who were not previously coffee drinkers, who drank caffeinated or decaffeinated coffee. And they measured a couple of things: heart rate, blood pressure, and they also measured blood vessel reactivity by looking at the blood flow to the tip of the finger before and after inflating a blood pressure cuff. So looking at the response of blood vessels after compression, so dilation, and that's an assessment of blood vessel function. And what they found was a couple of things. One, that if you drank a cup of caffeinated versus decaffeinated coffee, your blood vessel reactivity, which is a good thing, was better with the caffeinated coffee. However, the other thing that they found was that blood pressure went up a little bit in people who drank caffeinated coffee versus those who drank decaffeinated coffee. The heart rate didn't change, and a number of other things, blood chemicals in the body, also didn't change. So on the one hand, it looks like small doses of caffeine in people who weren't previously exposed, and this is young people, they were 22 to 30, seemed to improve blood vessel reactivity. That's a good thing. On the other hand, there was a slight increase in blood pressure, which is not such a good thing. So the study is small, mixed messages still, but I think the take-home message is that there are at least some effects of caffeine on blood vessel function that suggest an improvement in blood vessel function, at least in normal subjects. What was tested here was caffeinated and decaffeinated coffee, not any other caffeine delivery vehicle like, an energy drink, for example. So I think the only thing we can say right now is it looks like it may be caffeine, but caffeine in coffee that seems to mediate the blood vessel effects. In order to say something about caffeine by other means of delivery, you'd actually have to test it. The other effects of caffeine on your body, well, certainly there are a number of effects of caffeine, and we saw one of them in this study, and that's a rise in blood pressure. But there are also metabolic effects of caffeine in terms of the way you handle and metabolize fat, and sensitivity for people, for example, who have irregularities of heartbeat can actually have more in the way of those irregularities of heartbeat in the presence of caffeine. Again, for folks who are young, otherwise healthy, don't have blood vessel disease, it looks like at least blood vessel function here is good or improved by caffeine, but I don't think the same could necessarily be true of somebody, for example, who has extensive blood vessel disease, and that may be an issue to be concerned about as well. The American Heart Association recommendation is that really there isn't enough evidence to suggest that coffee, particularly in moderation, is dangerous in any way. We certainly wouldn't recommend, on the basis of this study, to go out and start drinking coffee if you don't drink it now, with the hope that you'll improve your blood vessel function. In fact, this study was done in normal people, and we don't know whether or not the response would be the same in people who have pre-existing blood vessel disease. But for the moment, there doesn't appear to be any evidence that coffee in moderation, 1 to 2 cups per day, is dangerous in any way to your overall cardiovascular health.